pleasure to introduce tonight's speaker, Valerie Dangler. Valerie and I not only have been personal friends, but professional colleagues for a number of years now. I know you're in for a great treat. Valerie is a very enthusiastic and passionate dental healthcare professional with a very well-established reputation for successful leadership and results, not only within industry, but also within the hygiene community itself. She's recognized as an expert in dental practice management, dental hygiene education, and also sales consulting. And I've worked with her in the past at places like Align Technology, where she's also a member of the faculty besides being part of our BioLace faculty. Valerie spent the last 26 years in the dental industry. So that means she started when she was 10. Very well done, Valerie, early achiever there. She served as a dental assistant, an office manager, an RDH, and a hygiene educator. And over the last decade, she's been responsible for the training and development of dental teams. Valerie graduated from NAU, Northern Arizona University, with a Bachelor of Science and received an AAS degree in dental hygiene from Rio Salado College. She's a licensed registered dental hygienist in Arizona, Utah, and Georgia. She holds a laser certification from the Academy of Laser Dentistry and is board certified to provide dental local anesthesia and nitrous oxide sedation. She's also a proud recipient of the U. Freedy Golden Scalar Award and an active member of the ADHA, having recently served as president of the Georgia Dental Hygiene Association. Valerie continues as an active member for Dental Codology. If I get that word wrong, let me know. A dental hygiene coding committee where she's provided testimony at the ADA in Chicago that was then recognized in the 2019 CDT manual. So all in all, a very active community member for dental hygiene, a very strident advocate for dental hygienists, not only in North America, but around the world, and also a close personal friend. It's my pleasure to introduce tonight's speaker, Valerie Dangler. Valerie, take it away.
Thank you so much, David. What a wonderful introduction. I'm excited to be here. Tonight, we're going to talk about lasers and how we're going to light up your operatory. Those of you that are new to lasers, we're going to do a high-level introduction. Those of you who are attending, maybe have you been using lasers for a while, hopefully you're going to get something new out of today's lecture. So moving along, let's see. So it's not advancing. Let's see if I can advance the slide. The slide is not advancing.
Try using your arrow key.
I'm using my
keyboard.
arrow key. Yep. Let's see if I click. How about, let me go down here. Here we go. Let's try that. Does that work? Can you see it?
Yes, ma'am.
Awesome. Okay. So we always have to start with a disclaimer. So definitely I have to make sure you all know that I'm an independent consultant of BioLace. The statements and views that we hear are opinions of my own. And based on my experiences, the course materials and those of myself, BioLace Inc. may not be endorsed. Such statement, views, or opinions. We do not want any photo taking or recording prohibited by the privacy laws. And, you know, basically laws governing the practice of dentistry, including lasers, will vary from state to state. So it's really important that you consult with your local laws or contact your local licensing board to determine the laws that apply in your state or province. David already gave me an amazing introduction, so I really don't need to spend too much time here. But this is what I do, and you know, I spend a lot of time over the last 26 years wearing multiple hats. I love dentistry. I love being a dental hygienist, and I'm so honored to be here today. And thank you to Joe from the BioLace team in Texas and to the Texas Dental Hygienists Association for having us come together this evening. So in addition to all that I do to help with providing oral health care for patients as a clinical hygienist and helping improve the lives of our patients through consulting and teaching and educating, I'm also a mother of 3 boys. And so they are my biggest supporters and one of the reasons that I keep going and doing what I do. All right, so next what I'm gonna have you guys do is I'm gonna have you pull out your phones like this and go ahead and get your camera. You're gonna see on my screen the QR code. You should all be very familiar with this. As any restaurant you may go to these days, this is how we're getting our menus with COVID, right? So just take your camera, you're gonna open up, it's gonna pop up, you're gonna open up, it's gonna say poll everywhere. Okay, and then if you see it says pollev.com/, you may need to input VDANGLER. So take a minute, go ahead and do that. Excellent. So you all should be at the poll everywhere. And slides. So what we're gonna see here is, and this may be actually cut off. Let's see, what city are you from? San Antonio, Austin. I know we got more people. Ooh, a lot of people from Austin. Anybody from outside of Texas? Looks like we have Texans representing the house tonight. All right, so let's go ahead and get to the next slide. Cedar Park, and I'm sorry, the slide's not advancing again. Let's see. There we go. All right. So the next one here is what is your role in the office? We want to see who we have online tonight. Do we have our hygienists, dentists, dental assistants, office administrators? So go ahead and input your answers there. So you can't see because of the way that the screen is populating, but we've got 81% of the attendees tonight are hygienists. I don't see any dentists representing in the house tonight, but we're very lucky to have team members. We've got some dental assistants, some office administrators, and I love it. I love to see that in the practice because it's the teamwork and the practice that makes the dream work. So thank you all for being here. And I will try to get this going again. Here we go. All right, so our objectives today, are we going to discuss the challenges our profession has faced during COVID-19? We're going to evaluate how we can improve patient care while practicing safely. We're going to go over a high level of lasers. Again, this is not a certification or training course on lasers that you'll get in Texas for 12 hours. So with our short time today, we're going to just do a brief overview and introduce you to the world of diode lasers. We'll learn what the diode laser is and what are the benefits for the hygienist, the patient, and the practice. And then hopefully I can help empower the hygienists on the group today. We have so much opportunity, especially now, what's going on in the media. And so we'll talk more about that. So does this look familiar? As we look at this here, we can see that there's been an impact of our world. Our dentistry was shooken up back in March, early March, when the coronavirus impacted what we were doing here in the US. It was March 11th, I believe, when the World Health Organization declared COVID-19 a pandemic. And by March 16th, many of you, like myself, were furloughed. You know, offices were shut down by the ADA recommendations. Our dentists had to temporarily lay us off, and they were dealing with lots of stress while they were still trying to treat and triage their emergency patients, dealing with all the government things that were being thrown at them with CARES Act, the PP loans, and what they were going to do, decisions that they were going to make to help float their business so we can keep our teams intact and also keep our doors open to care for our patients. Some other things that happened is the CDC. If you guys remember, I'm sure you all can remember this, we would get something one day, and the very next day it would be something else in terms of the recommendations. So a lot of us were very confused. Things were changing. It was a daily cycle of uncertainty. Then as we looked to go back to work, we had troubles getting PPE. Now that we were ready to go back in the doors, there was price gouging going on. We could not get adequate PPE in order to get back to work. We still were doing our best to practice social distancing, but as essential care workers, we had to get back to the office. Many of you, like me, had my kids home and on homeschool, and they still are. Some of you may be still experiencing the virtual homeschool as well. So our lives have been totally changed with the effects of COVID-19. And just when we get back to the office and things start getting to be a little bit normal in our new norm, you know, we've got the face shields, we've got our PPE, we've got high back sections. We've got air filtration systems. We've got UV lights going around. All these things that our dentists have put in place to keep us safe, our team safe, and our patients safe. Then the World Health Organization comes out again on August 12th and recommends the delay of dental services once again. Luckily, the American Dental Association respectfully disagreed and provided the statement that oral health is an integral part of overall health. The president of the ADA stated that dentistry is essential healthcare because of the role in evaluating, diagnosing, preventing, or treating oral disease, which can affect systemic health. And that's huge. That's huge to us as preventative care specialists and what we do every day to treat the inflammation in our practice to prevent systemic health. Furthermore, as many of you have may seen, hygienists that are active in your hygiene community, maybe on social media platforms, I was heartbroken to see many of the Facebook forums where hygienists were very emotional, sharing their experiences when they returned to the office. Many of them were not feeling safe, and because of that, they decided to leave the profession. Dr. Bicuspid launched a survey calling out to the hygienists in the real world, asking them, what are your biggest fears? What are your barriers as you overcome coming back to the office and working in your operatory? And many of those hygienists voiced their concerns with not feeling safe. That was one of their #1 concerns, is not feeling safe, not having the adequate infection control protocols in place. And so next we will go ahead and see what those common barriers were. So based on that, the survey, we saw safety was the #1 concern. Okay, safety is the most critical issue that our profession is going through, be on top of the list at risk, as dental hygienists being at risk for COVID-19. However, I want you to keep in mind, dentistry is one of the safest places in healthcare. We have all the proper standard precautions. We have the infection control and PPE in place. And I feel safer in my office with all our systems that we put in place than I do in a grocery store or, visiting a restaurant. So with the UV lights, the air purification systems, the N95 masks, the barriers, we actually change our lab coats between patients. I change my surgical cap between patients. We launder them right in the office. We are doing everything we can by the book to really ensure that we are keeping ourselves safe, our patients safe, and our team safe. The second thing was aerosols, right? So there's a huge concern with not being able to use our cavitrons. And a lot of hygienists voice those concerns. And I know me, it's part of my DNA. When I was in hygiene school training to use a cavitron, we were taught, the science behind it. It's not just like hand scaling where you're scraping teeth. Okay, we've got that acoustic turbulence. We've got that lavage. We got the water that's breaking the bacterial cell wall. So it's doing more for us. Not to mention going to just hand scaling. I don't know about you, but I came home and my hands were puffy and swollen. Okay, so the hand fatigue that we got from hand scaling all day and not being able to use our ultrasonics. So diode lasers is a great option that we're going to talk about today. It allows us to reduce the bacteria and manage our perio patients without aerosols or spray of water. And so we'll go into that a little bit more today. And then last but not least, most of the barriers that the hygienist reported was scheduling. Okay, and you guys know, it's a new world, right? So our patients are waiting out in their cars. We're texting them, telling them when to come in. We have to screen them by taking their temperatures, doing questionnaires before we bring them back. And so we're doing all these added things in addition to what I talked about, the added PPE, the N95 mask, changing between patients, letting the room sit so the air can recirculate for a certain amount of time to avoid contamination. So we've improved these areas of infection control, but some are not scheduling to meet the needs of what we need to do to allow time And so the hygienist that responded to this is not getting enough time to turn the room over and have the doctor exam. So my recommendation to you guys is, especially right now, when we all got back in May, some of you in June, got back to the practice, most offices were reporting record months. We were busy. Schedules were busy. We were getting slammed. What we're seeing now in the fall is those schedules are actually starting to light up. Okay. And the reason is because now those 6-month recare that we got when we were closed down, we're here. We're hitting that now. Okay. September, October, November. And so we're seeing a lighter amount of schedules. So there's 2 solutions that we can do here. One is work with your front office, work with your doctors. Because if there's a reduced amount of patient volume, don't have them scrunch your patients together and then have you come in later and leave earlier. Stagger your patients so you have adequate time between the patients to do what we need to do to ensure our infection control. What you're also going to find is you're going to spend more time with the patients. You're going to be able to evaluate them. Most of our patients are coming in and they're overdue, so they are bleeding. They're inflamed. They've got a lot of inflammation going on. And so it gives us an opportunity to also do same-day treatment and offer our patients same-day care, having that time to get their treatment started. So again, I really encourage you to just have the conversations with your practice and have those crucial conversations with your employer. So here I'm going to ask, are you currently using ultrasonics in your practice? I want to see how many of you are using ultrasonics in your practice. I've got 1 response so far. If you need to redo the QRU code, here it is. You can redo the QRU code. All right, well, it doesn't look like that's working right now, so we'll go ahead and move along. It did look like most of you are back to using ultrasonics. However, there were some that were reporting that they are still not using ultrasonics. All right, so we've talked about the bloom and the gloom and everything that's been happening in our world over the last several months. And one thing that we can do is look at the silver lining of all this. And with crisis there comes opportunity. We are quickly adapting and we are evolving. Coronavirus has been a catalyst for healthcare revolution. We're seeing increased teledentistry and virtual platforms with remote monitoring, allowing us to do more for our patients. For example, with clear aligners, patients don't even need to come into the practice. We can manage them at home. We are dealing with infection control protocols. We're paying attention to the water safety lines now. Not too many people knew what OSAP was before COVID. And now we know that, the water line safety and air control are critical as we move forward in our new norm. We've also incorporated paperless technologies, where patients can actually check in, text, and pay their bill all without touching or in the office using their credit card or anything like that. So there's been a lot of great advances in dentistry that we've implemented since COVID. This one here, if you can see, this is a UV bot, and this I got from an office in Boston. This thing is like the robot that we have that does the vacuum cleaner. This thing goes all around the office, and when the office is closed, and it goes and provides UV light to disinfect, decontaminate. It was a really neat thing that I saw just the other day, and so I wanted to share that with you. Again, we're definitely seeing innovations, and we're seeing how we are practicing in our new norm. The other great news up here is, if you guys haven't seen, that Closest just released, they had a lab study that revealed that their rinse was effective against SARS-CoV-2. It killed 98.4% in only 30 seconds. And so another claim was Eversmile's pretreatment rates, and they did claim to kill the human coronavirus in only 15 seconds. However, I've yet to find their study, so I'm still looking for that. As we continue to see the breakthroughs to improve how we practice dentistry in our new norm, dentistry just got more exciting. So going forward, overcoming the barriers that we had, it's so important that we collaborate with our dentists. Communication, right? Communication has been the best thing since COVID happened. And when I speak with offices around the country and organizations, the one thing that the employees were grateful for was when the other party over communicated, whether it was the dentist or the organization that they worked for, when they were part of they were part of the solution. The team was becoming a part of the solution of what was going on in the office, being able to help, again, help log water lines, help log, new infection control procedures, order PPE, giving us employees as a team the ability to really help serve during this time. And so the offices that did not communicate, those are the hygienists that have reported that they have either left work, looked for a new job, or just left the profession altogether. So I encourage you, as you get back to the office, find solutions, meet with your doctor, return to work with a protocol and a plan. What gets measured gets done. So start looking at your protocols pre-COVID and what have you changed since then to adapt in our new norm. Here's one thing we can closely look at. What does our periodontal protocol look like? We have overwhelming evidence that there is studies with the link between gum disease and respiratory failure in COVID-19 patients. There's been publication after publication on oral health and supporting what we do every day as oral healthcare professionals. One thing this pandemic has taught us is the threat of biofilm that releases toxins into our bloodstream and its relative factors with COVID and other relatable systemic conditions that are threatening diseases. So with this being in the media, finally patients are getting it. We really have an opportunity here to showcase what we do as preventative specialists that also assess and provide therapeutic treatment for inflammation. Our patients are showing up to our office, like I said earlier, with in an inflammatory state. And our skills as a hygienist, we're able to make an impact and reduce that bacterial load. We can reduce the risk of diabetes, cardiovascular disease, stroke, Alzheimer's, cancer, and many other systemic illnesses. Patients are expecting dentistry to look different as they return to our practices. Again, our opportunity is now. More than ever, they will look to us as the oral health care experts that we are, for products and services that we help to improve their oral health. And so I'm going to ask my next question. What is your periodontal program in your practice? Would you say it's excellent, good, fair, or poor? Awesome. So excellent, we've got 37% reporting excellent down to 35. 35% excellent, 45% good, and only 20% or 20% say it's fair. Luckily, no one says it's poor. So that's good news. All right, so do hygienists in your practice use lasers? True or false? Okay, so about 25% of the attendees on today's webinar, oh, it's going down, 20%, currently use diode lasers in their practice. The other 80% do not, and so I'm glad you're joining us today. Okay, so why lasers? Although lasers are not new to dentistry, they become an essential tool in the modern dental practice. I've been using lasers since early 2003, 2004. So lasers are not new. They've been around. My mentor has been using lasers for 30 years. However, they've gotten better. And I'm excited to share with you some of the latest advances in lasers on the webinar today. So diode lasers are the most common used in hygiene. We use it to reduce bacteria, inhibit the viral pathogens, and also to promote healing. Soft tissue lasers allowed us to perform more procedures with more predictable outcomes. And today, diode lasers are commonly used pre-procedurally to reduce the incidence of bacteremia and mitigate risk for aerosols. Here where we look at what the American Academy of Periodontology statement, they say that periodontal health should be achieved in the least invasive and most cost-effective manner to the patient. Hygienists can offer benefits of non-surgical laser therapy to their patients while providing state-of-the-art care. So let's get into, again, some laser basics. Again, high-level overview. The term laser is an acronym for light amplification by stimulated emission of radiation. The first laser application in dentistry was in the early 1960s, and that was more so with the hard and tissue soft laser applications. And that's where they had that first ruby laser, if you heard about the ruby lasers, and that's where that started. So how do they work? Lasers produce a light energy. They can be absorbed by a target tissue, and the absorption process produces a thermal reaction in the tissue. The radiation involved in generating laser light is non-ionizing. It does not produce the same effects attributed to X radiation. So it is safe. There's no contraindications. It could be used on pregnant patients, children, again, with no contraindications. Light energy, it's non-invasive. It's non-toxic. It's a non-toxic alternative to pharmaceuticals that help us reduce inflammation, pain, reduces bacteria, and of course stimulates wound healing while leaving healthy tissue intact. So how do they work? Again, all lasers work by delivering energy in the form of light. Okay. The laser tissue interactions are settings that are dependent on its density and duration of exposure. When used for surgical and dental procedures, the laser acts as a cutting instrument or a vaporizer of tissue that it comes in contact with. And again, that's not something we do in hygiene. That's used in more surgical dental procedures. In hygiene, we use diode lasers directly on the cellular structure, destroying the cell walls, altering the DNA, modifying the metabolic process, and ungluing the polysaccharide structure of the biofilm. Our main objective is to eliminate the periodontal pathogens through its antibacterial property and promoting the return of the periodontium to the state of health through its anti-inflammatory effect. Our goal with using lasers in the treatment of lasers is that it's to the least amount of energy necessary to achieve the desired response. And so when we start looking at more into really how lasers work from a physics standpoint, we won't get into too much of that today, but the laser light has 4 different interactions with the target tissue, okay? And that is dependent on the optical properties of the tissue. But what it does, it's got absorption, okay? And for absorption, the photon absorbs into the tissue and it's attracted to the chromophores. Okay, that's required. And when that light is attracted and absorbed, then it's converted into thermal energy. And why diode lasers work so well is because they are attracted to the melanin pigmentations of the chromophores. And so our periodontal pathogens are that red, orange, complex bacteria. That's why it works so well in our periodontal patients. So that's what we want. Our goal is to get the absorption of laser by light by the target tissue, and as that is the primary and the beneficial effect of laser energy. What also can happen though is transmission. You'll see that with reflection here. You can see scattering where it goes and it scatters off. So again, what our goal is to get that absorption. Once we increase the photon absorption by reducing its reflectance, the scattering and the transmission, then the absorption of the laser light is dependent on the water content. And like I said, that tissue pigmentation and the laser wavelength. So there's some things that we can control as operators that are really, really important. And again, you're gonna go deep into this once you all go to your laser training. And I know Joe is a great resource with BioLace that helped put this program together with the Texas Dental Hygiene Association. So he can help follow up with additional training for you all. But what we're gonna talk about now is here's the things that you can control. And again, these things are important. The power setting is important because that's, that's your density. So your power, the rate and duration of exposure. And we measure this by a continuous wave or pulse duration. And then the method by which energy is delivered to the target tissue. We can deliver that either by contacting the tissue going into the sulcus or non-contact. And we would use, for example, like a non-contact if we're treating an aphthous ulcer. And we're not going to be directly on the lesion. So clinicians do have precise control over the laser to achieve the desired tissue effect by adjusting any of the 4 variables. And that will be power, the size, okay, typically the fiber, total treatment time, and then the repetition rate, okay? So one of the unique characteristics of the laser wavelength emissions is that we can control some of those factors that affect laser tissue interaction. And a clinical tip I want to share with you is you definitely want to match the proper wavelength with the chromophores that are present in the target tissue. So moving on, as we look at lasers and all the many, and again, this is just a soft tissue laser. There's various lasers, in the market that we use to treat patients. Today, we're talking about soft tissue lasers. And there's various applications, as you can see here. I mean, we can go down the list, uncovering an implant, pulpotomy as an adjunct to root canal, coagulation of extraction sites, TMJ management. We already talked about reducing inflammation, photobiomodulation. We'll talk more about that. Doctors use it for their gingivectomies, gingivoplasties, troughing so they don't have to pack cord anymore. But again, this is what's used in dentistry. More of what we're going to do in hygiene is here. And this is where we keep it into our realm of what we do for hygiene. We use it for laser bacterial reduction. We use it for our assisted periodontal therapy. We treat aphthous ulcers and herpetic lesions. We can provide hemostasis, help treat dental pain with patients who have TMJ. We also can provide tooth whitening and desensitize with certain types of lasers and apparatuses. Again, always look into your Practice Act and determine what your Practice Act allows. So for example, with the Texas Dental Hygiene Association, I did call Janessa. Many of you know Janessa, who's with the Texas Hygiene Association, and she shared with me a few things. She said that the Texas lasers change from general to direct supervision. They still need 12 hours of training. 3 of that needs to be hands-on. Your doctor must also receive the same 12 hours if the hygienist is using lasers in the practice. So for example, if the doctor gets a laser and wants to use procedures, he doesn't necessarily need to be certified, let's say, unless it's in his Practice Act. But in order for the hygienist to use it in his practice, we definitely want to make sure that the doctor is getting equal training. So there's no curettage allowed in Texas, and there's no initiation. There is a gray area, however. if the laser tip self-initiates. And what that means is if it attracts to those pigments, blood, debris, a lot of times what that can happen when you're using laser at a low level, it'll actually initiate that tip. Okay, and so it heats that, there's thermal energy going on and it heats that tip. And so if you see that happening, it is up to the supervising dentist to let you know if you can proceed. The Practice Act doesn't say that you have to go get the doctor, or whether it's the doctor has a standing order in your practice. So that's the gray area, but you're not supposed to be initiating. So my recommendation to you is once you do remove that laser tip, you either get a new tip, or if you're working with the old spool, you can cleave that, clean it, you get a wet 2x2, get that off. Like I said, cleave it, bump it down a little bit, and then you're able to proceed. So some of the common terminology that we see with dental lasers, many of you may have seen LBR. And LBR stands for laser bacterial reduction. Laser bacterial reduction can be done as a pre-procedural disinfection procedure that reduces biofilm and viral load in the sulcus. We do this to help mitigate the risk for bacteremia, okay? Opening those blood vessels when we're probing or scaling and inducing that bacteria into the bloodstream. If we do that LBR first, we are definitely reducing that risk for our patients. And then also the potential bacteria and viral loads that are produced in aerosols. So if we treat our patients first, we are reducing and mitigating that risk as well. Laser bacterial reduction is also known as decontamination, can be used as post-procedural as well for inflammation. So if you use LBR and you do it in a pre-procedural, then you do your hygiene procedure, you're seeing inflammation, you can then again treat the areas of inflammation. Laser-assisted periodontal therapy, we use that, a cohesive term, with our non-surgical periodontal therapy cases, AKA SRP. Okay, and then also our therapeutic treatment of gingivitis. And what we know, in order for our patients to be diagnosed the gingivitis, the D4346, they need to have 30% or more inflammation and bleeding present in order for it to be considered gingivitis. So periodebridement, sulcular debridement with epithelia and granulation tissue can be removed as well. And that's where states allow. And that's similar to, like I said, curettage. If that's it, I know in Texas, I don't believe you can do that in Texas, but there are some states that is still part of their Practice Act. And then the last one here is PBM, and that's photobiomodulation, also known as low-level light therapy. This is a great treatment that is used. I mean, low-level light therapy, my chiropractor uses it. And I specifically go to him because he uses a low-level light therapy on my back. It stimulates healing, reduces the inflammation. Like many of you as a hygienist, having the neck issues, wrist issues, it's also really great used in physical therapy and other aspects of medicine. What we can use it for in dentistry is the treatment of aphthous ulcers, herpetic lesions, and providing hemostasis, and more specifically pain therapy, okay, it's for the treatment of a TMJ. And there is a new code that came out, as David mentioned, in 2019 in the ADA CDT book. It's the D9130. And basically what that states is it's for TMD, but it's a non-invasive physical therapy. The therapy including but not limited to massage, ultrasound, cold application to provide relief from muscle spasms, inflammation or pain, intending to improve freedom and range of motion in the joint function. So that is I'll show you later some examples of where we use PBM for the TMD, and that is a code that you guys can now use that's available for your practice. And I need some water. All right. So finally, we're going to talk a little bit about the diode laser that I know BioLace is so excited about, and I am so excited about, because this is a hygiene laser that was designed by hygienists for hygienists. I feel very honored and privileged to sit with, there was a board of hygienists that were able to really look at this laser and provide feedback to R&D, research and development, of what we need as hygienists. Okay, and so what we found is, that this, in terms of the handle, we were able to provide feedback on making sure that the grip was sufficient, light, so there's not fatigue on the wrist. We also, BioLace, I know, provided this to be able to share with their customers, because now they can offer a hygiene laser at a lower price point so that every hygienist can have a laser in their operatory. And as a practicing hygienist for 17 years using lasers, I can tell you, if you don't have one in your operatory and you have to go get it from the other hygienist or the doctor's using it, your program's not going to sustain. What's going to happen is you're going to say, okay, next time. Okay, next time. And when you really get on board as a laser practice, there is no next time, because it's a part of your standard of care. So as patients come in for treatment, my patients knew laser was a part of their process. Once they were a new patient and we enrolled them into periodontal therapy, laser was included in that. If we had to, and then every periodontal maintenance, they still had laser therapy at their periodontal maintenance. So they knew anytime that they were coming through periodontal therapy and ongoing, they were going to have laser in our practice. Other things we let our patients know, obviously, is, the other benefits it has with the treatment of aphthous ulcers and herpetic lesions. And that was a huge practice builder for us. Patients love that. They didn't have to, as soon as that prodromal stage happened, I would tell my patients, when you feel that, come in, just call the office. Jane at the front desk knows, she will work you in. It only takes me less than a few minutes. I'll go in, I'll treat the patient's herpetic lesion, get them out, and they are happy. It automatically relieves pain, so that prodromal throbbing goes away. It automatically starts crusting over, so that induces the healing, where typically what we would do is get a prescription or get an over-the-counter, and the creams would take 2 weeks. Meanwhile, it's getting fatter, it's getting more vesicles, patients don't want to be seen in public because it's big, it's huge. So it's really an awesome tool that we have, and a service that we can provide for our patients. So again, getting back to the Epic H, the new laser by BioLace, the Epic Hygiene. This is a 980 wavelength laser, and the difference with that is, that BioLace just received FDA clearance for this, I believe in March. So right when COVID was happening, they were the only hygiene laser designed for hygienists by hygienists that was cleared for that laser bacteria reduction, and they contribute that to the 980 wavelength that it has. So again, getting onto a program with lasers in your practice, it is really important that if there is multiple hygienists in the practice, that we do have a laser in each operatory. And again, that's why BioLace provided this solution by getting this more affordable, so you can each get one of these in your practice. One of the other great things, again, designed by hygienists, so we wanted to make it easy on you and have these preset hygiene settings to really help you quickly get started. Again, the handpiece design, we tailored it to fit the needs of the hygienist. It's got this intuitive interface that you can see. It gives you quick procedure selection and easy setting adjustments. It does have a premium battery, so it's rechargeable with over 8 hours of use. And it's also portable, right? So you don't have a cord, you don't have to worry about it. You can take it from operatory to operatory. And it's easy if you are working on an assisted hygiene model and I'm working out of 2 rooms, I can take it with me as my laser as the hygienist. All right, so if you want to learn more about the Epic Hygiene laser, again, Joe is going to be available after this for any type of follow-up questions on that. So now let's look at some additional applications in hygiene. And I talked earlier about one of the things we can do is teeth whitening. So while the Epic H does not have this apparatus, our Epic X does. Okay, so this is the Epic X by Biolase. And you can see it's got this unit here that attaches to it and allows us to do whitening. So the laser energy from the laser interacts with the chromophores in the proprietary activating gel, and it helps accelerate the whitening. You know, those cells start accelerating and going faster and faster and faster, so the whitening actually takes place faster while in the office. The other thing that the Epic X has is the pain therapy. This is an example of, I mentioned earlier, for a patient that is treating the TMJ area for her TMD. And you can see this apparatus here that allows us to go ahead and set that there. We use it for just a few minutes. It's going to stimulate the cellular function. It activates the mitochondria. So that releases the nitric oxide and increases vasodilation, okay, which helps with that inflammatory effect, anti-inflammatory effect. And then it's going to promote the wound healing, as we talked about earlier, and tissue regeneration. So it's really great at modulating the immune system and helping patients alleviate pain. And why is that important? Why is it important that we have alternatives for pain in our practice? Well, first, patients don't like to come to the dentist because of pain. Okay, it's one of the major things why they don't come to see us is for pain. So we want to make sure if they are in pain, there's many other things that lasers can do on your doctor side too that will prevent pain or at least reduce pain. But one of the major things I'm very passionate about is addressing the opioid epidemic. You know, a lot of patients come in, and I actually remember a patient of mine years ago that would come in, her name was Pam, and she would come in frequently, let's just say frequently. She was a great patient. She did her dentistry. She did the dentistry she needed. But one of the things Pam was experiencing was TMD problems. And so back then, this is 20 years ago, my doctor would just write her a script, you know, anti-inflammatories, and write her a script for muscle relaxers. Well, Pam got addicted to those, and I remember Pam losing her life while I was still an employee at very young age, because one addiction led to another, and she ended up losing her life. And so today we are still faced with global challenges in dentistry, actually more than ever, with the opioid epidemic. Our kids are dying. Those of you watching today probably know somebody, a friend of your kids or a friend of a friend whose child has experienced that, or even a loved one in your family who is experiencing the opioid epidemic. And so it really is our responsibility in dentistry, being that a lot of the opioid prescriptions actually come from dentistry, okay? And so dental professionals, we really have that responsibility to help affect change in what we can do. So the CDC did say that the drug overdose death rate nearly quadrupled just in the past 2 decades. And so what laser therapy does, it's going to definitely help us reduce that pain, and it's going to help eliminate the need for pain medication, stimulate healing, and get our patients on their way in a more natural, holistic way, right? Another reason why I love lasers. So lasers are minimally invasive, holistic, and really are a modern approach to dentistry. Let's see, so, you know, despite access to dental care, we know with dental services, antibiotics and fluoridation, the burden of oral disease still remains even in developed countries, okay? So we know that decay and gum disease are still the 2 most prevalent infections in the world. And so what laser therapy allows us to do is combat a multitude of national and global challenges, one of those being antimicrobial resistance. So this is another challenge that we're facing today. And one of the top 10 threats to the global pandemic, or not the global health, is antimicrobial resistance. So it's really crucial to preserve antimicrobials currently available through prevention and by utilizing new therapies and technologies. And you can see here that the International Coalition of Medicine Regulatory Authorities calls on all healthcare providers to find alternatives that minimize the use of antimicrobials. The beauty of lasers is we eliminate the need for antimicrobials, and we can still stimulate heating, reduce infection, and help our patients toward optimum oral health. So how do you incorporate lasers into the current models of care that you have in your practice? 80% of you on today said that you currently do not have lasers. And I know what you're thinking. You're thinking, oh my goodness, Valerie, one more thing I have to do, right? We already talked about time being, such an issue for us. But what I can share with you in my experience is once you get your laser implemented, you're going to absolutely love it. And what it's going to do, it's going to provide you career satisfaction because you're going to see your patients get healthier. And when your patients start coming back on those maintenance appointments, those recare appointments, that typically you would see, yes, you do a scaling and root planning, and then you get back, they're still bleeding, but what do? We'll see you in 3 months. We'll see you in 4 months, right? Meanwhile, we still have active bleeding sites. So what lasers allows us to do is incorporate it into our model of care and really develop a comprehensive care program where we can see the patient, provide their periodontal therapy, use lasers, get them back for their evaluation. If they are still seeing bleeding, pocketing, signs of infection, we then take out the laser and we hit it again. And then we get them back and we hit it again. And you're gonna see over time less and less bleeding. You're gonna see more healing, and eventually your patients are going to start coming in every 3 months with tight, pink, healthy tissue and no bleeding. I've had patients go from 9mm pockets down to 3mm pockets with no bleeding. Now those patients, of course, we referred them to a periodontist. There was bone loss. There was, there's other things going on under the tissue. But we really, because she onboarded us she did not want to go to the periodontist. And once we got her through a level health and showed her what we can do, she finally then decided to go to the periodontist and get some bone grafting done. So other things that I've seen with lasers in my experience. I remember in school, I was taught, once bone is gone, it's gone. And that's what we were taught until I started practicing, and I would put my patients through laser therapy. I'd get them in on tight, 3-month recare appointments. And then over time, I'd update their bite wings. And then I started seeing wow, where I used to see defects, I'm now seeing bone fill into these areas. I was amazed. It's amazing. And once you start seeing what lasers can do for your practice, you'll never go back, right? So here's where I can help you kind of look at how you're going to incorporate this into your office, if this will give you a good visual, okay? So this is a diagram that BioLace actually supplies in their Epic Hygiene practice guide that you get when you get your Epic Hygiene laser. And what it shows here is, first you can see gross biofilm and calculus. So when we get these patients that come in and they're gross debridement, they need a gross debridement, they go over here, right? So we do that gross debridement, then treat them for pocket therapy with laser. If they don't need a gross debridement, they come here and we continue our oral evaluation, we do our treatment plan, and we determine which bucket do they fall in. Are they a prophylaxis, 1110? Are they a gingivitis patient, which is bleeding and inflammation with 30% or more of the dentition? Or are they a periodontal patient? Okay, are we seeing clinical attachment loss? Are we, recession, clinical attachment loss? So we need to enroll them into periodontal therapy. So we just include lasers as part of those already existing treatment buckets that we have. And so a standard hygiene appointment looks like this. We greet our patients, we walk them to the treatment room, we do a hygiene assessment. And I'm going to stress this, a hygiene assessment is the most critical thing and the most important thing I feel that you can do for your patients. It's where we do our x-rays, we scan our patients if you have a scanner for malocclusion or fractures. We use intraoral cameras. We identify any areas of oral abnormalities, such as oral cancer screenings. We look for institute a Canberra program. We do a periodontal risk assessment. Again, we look at that occlusal disease assessment. So we do so much in an hour. We really, really do. But it's really important that when our patients come in, that we evaluate our patients' needs based on the assessment. Just because the schedule says today it's a 1110 doesn't mean that my patient sits down and I'm going to pick up a scaler and do a 1110. I first have to look at and assess my patient, especially now with COVID. Our patients are coming in as an inflammatory mess. They're overdue, they're stressed, they've been through the same emotions that we have, right? So they're gonna need additional care. And so use that time in your hygiene assessment to really evaluate your patient and set them up for proper treatment planning and success. So here's what that looks like. So as your patient comes in, it's going to take about 20 minutes to really thoroughly get through, taking a periodontal assessment and looking for any other types of oral abnormalities. Again, checking their bite. Do they have recession? Is there malocclusion? Are there fractures? Taking those intraoral pictures and really setting the patient up for your doctor. So that way, when your doctor comes in, you have a beautiful handoff and you're already have had the opportunity to talk to your patient, educate them, build that trust. And so let's not forget the opportunities that we have there to really influence our patients. So during this assessment, when we institute LBR as a pre-procedure, we would typically do it during this time here. Same thing if a patient comes in and has lesions, we want to take care of that right away. Then if they're a typical hygiene prophylaxis, we would complete the procedure. Our dentist will come in, we can wrap up and go from there. Now, if they come in and let's say they're a gingivitis patient, okay? We want to get our doctors in for the exam so we can get our co-diagnosis in that first 20 minutes. My doctor knows I just need 15 to 20 minutes and then they can come in at any time, okay? So when they come in, and I prefer that they come in early, so that way, again, if I have to start any same day dentistry today, if my 1110 on the schedule is now a gingivitis therapy, my dentist comes in, she gives me the blessing, she talks to the patient, and we get going. And I'm able to finish it up that day and then get my patient back for a 6 to 8 week evaluation. Now, let's say the patient needs scaling and root planing, periodontal therapy. Okay, we get them back to do that. Absolutely. Or if we have enough time, I also encourage offices to start same day dentistry. So even if we could start a quad, we want to definitely, be able to start something, even if it's just laser that day, start a full mouth laser and then start scaling a quad and then get them back to do the other 3 quads or, whatever we need to do. Because I know insurance sometimes has their restrictions where you can only do half and half. But again, you can work that out with your office team, your insurance coordinators to help you design that's going to fit best with your schedule. All right, guys. So again, the oral systemic link, it's our best educational tool, especially now what we've got going on and what we know with COVID-19, the problems with aerosols, and why it's so important that we are helping our patients maintain good oral health because of the overall systemic relation with inflammation. And inflammation, it's not only, contributing to, cardiovascular disease. We've also seen Alzheimer's come to the media recently. We've also seen cancers now. There's studies on, colon and other lung cancers that they're finding the same bacteria that are starting to cause problems with development and the correlation there. So we really have an opportunity more than ever to serve our patients. And the evidence is there. There's substantial evidence that supports the oral systemic link. And You know, so it's up to you to decide, you know, what do you want to incorporate? What is your standard of care in your practice? Looking now that we talked about your perio protocol, you know, some of you said you had a great perio protocol. Some said, oh, it was fair. You know, so think about it. What would you like to do and what would you like to incorporate? Now knowing about lasers and how you can help the practice improve their model of care that meets the needs of today's consumer, your patients. And the great thing for your practice, for your dentist and the business of the practice is the ROI opportunity, right? So we know that 40 to 60% of hygiene procedures should be periodontally coded, okay? So whether it's gingivitis or scaling and root planing or periodontal maintenance. So those codes, the 4910, 4341, 4342, 4346, about 60% of your practice, up to 60% of your practice should have that about 60% of those codes listed in your practice management software. However, what we find is when I pull numbers and I look at the data and I look at the metrics, and many of the practices that I work with across the country, I still find that the prophylaxis is the most common dental hygiene procedure. I mean, I've been in practices where there were 72% of prophies and only 7% of periodontal therapies that are coming through. So we have huge opportunities to help with again, help improve the model of care for our patients that will not only provide a valuable service, but create a profit center for your practice. Your dentists need that now. They're finally looking at hygiene as a profit center. I can't tell you in 26 years how many times I've heard hygiene is a lost leader. And I argue that every time. Hygiene is a profit center, and you could be happy creating the model of care that you want, the highest level of standard of care, providing comprehensive dentistry, and getting rewarded by the financials of your practice. So here's an example. If you just enrolled 2 additional patients per week, okay, so 2 additional patients you enrolled in a periodontal therapy, so 4 cods of scaling and root planing with laser assisted therapy. And I treatment plan these very low, okay? Because some practices are fee for service, some are heavily PPO. So I met it in the middle, and a very conservative number. If we just did 2 extra patients per week, that would generate an additional $70,000 a year for your practice. Okay, so that would really help with what we're overcoming with the PPE problems, with our doctors, you know, being closed for 3 to 4 months, making up that revenue. And we're taking care of our patients the way we should, the way science tells us that we should. We're going to be able to add value and add awareness and really make an impact to the practice. But even more, when incorporating laser therapy to your practice, you are setting yourself apart from the dentist down the street. Like I said earlier, your patients are expecting your practice to look differently. And this is one thing that you can implement in addition to all the other things we did, UV lights, you know, air purification systems, and all the other things that we've implemented already. These are some of the adding laser provides value for your patients, not only their oral health, but also it's a great referral source and helps you differentiate from the practice. So, will practices ever return to normal? I don't think so, right? I mean, I feel that this is, you know, what is the new normal? What is the new normal? You think we'll go back? I don't think we will. I mean, when we look in the 1980s with the AIDS crisis, it wasn't normal to wear masks and gloves. I know my first office I worked in, my doctor told me, you know, he never wore masks and gloves, and a lot of my instructors never wore masks and gloves in hygiene school. But today it's normal. In fact, it's mandated. So as we move forward in our new norms safely with our PPE and technology, it allowing us to mitigate risk while providing our patients the highest standard of care. Okay, so we really have an opportunity as dental hygienists today to showcase our leadership in our practices and for our profession. Remember, we must be resilient during these times. We are essential leaders in our industry, whether it be infection control, lasers, or whatever training. we have the knowledge to help train our team members and implement systems to support all our team members when it comes to new protocols. So go to your doctors, show them that you care, not only for the patients in your practice, but for your team and for the business. Many of your doctors lose sleep over each night. There's still doctors losing sleep. In fact, it's anticipated that we may get another wave of COVID. And so I know that there's doctors worried about another shutdown. So we've got to do as much as we can today with the patients we have, get them healthy, get them healthy now, and really help our practices and help our patients. So from one hygienist to another, I definitely will continue on my journey to be the compassionate leader I am in healthcare, and I know that you are. But more than ever, you have an opportunity to make a difference in what you do, and your time is now. There's never been a time where we've been put in the spotlight so much with how essential and how important we are. So your time is now. So I leave you with this. I'd like to end with this, and some of you, if you've seen me lecture before, I typically end with this. Do what you love, and you'll never work a day in your life. Registered dental hygienist. My passion to empower hygienists to practice the highest standard of care. I hope that we can help you overcome obstacles that's holding you back, and get you back to loving your why. Why did you get into this profession to begin with? Why did you become a hygienist? Let's get back there. Let's get back to comprehensive care. Let's improve our standard of care. So I'm going to ask you one thing before we leave. Based on what you learned today, what is one thing you will do differently or want to learn about to help improve your practice? Now, if you need the QR code, I'm going to put that up again because that might have gone out. So I've got that up. Go ahead and hit the QR code. And then go ahead and answer the question that's up there on your screen. And let's see if it's going to come through. It may not come through. It still may not be working, but I will look at the poll results later. And definitely I want to, make sure that we take some time to answer questions. So what's next is we're gonna have Joe Hannon. He's the account manager at BioLace. He helped put this together with the Texas Dental Hygiene Association. He's available for questions. I'm available for questions. If you have something that you want to ask me that pops up later, go ahead and connect. You can connect with me on Instagram. My email's there. Those are the best ways to get in touch with me. And I'm happy to follow up and answer any other questions you have. Thank you so much for the opportunity to share my passion with you all this evening. And reach out. Like I said, reach out if there's anything that we can do. So now I'm going to go ahead and turn it over for questions.
Thank you, Valerie, for a really wonderful presentation. I love seeing it. Every time I see it, it gets better. So great job.
Thanks.
Now, Joe, I do see that you're available. Did you have anything to share on the screen, or would you like to present via mic? Joe,
and then did we have questions too that we were going to field from the chat box?
Yes, we do. We have 4 actually, which we could definitely use some more. I'll read them to you, but if you guys the attendees want to ask a question, just click on the toolbar at the bottom, click the Q&A button, and then type one in, and we'll get it in front of Valerie. So first we have a question from Hector Mendoza. What do you charge a patient for laser treatment during a perio maintenance appointment?
That's a great question. And you're going to see that kind of all across the board, right? So I've worked in hundreds of practices with lasers, and it really depends on what that type of practice is designed. So for example, if they were in inner city area, you know, a lower income, we want to keep it affordable. We want to make this affordable for people, right? And so $25, I mean, one of my practice I worked in, we charged $25. That was it. So every time our patients came in through periodontal maintenance, they knew, and I set that up in the initial treatment plan, and they knew that there was going to be a $25 copay that day on top of their periodontal maintenance 20% that they would pay typically if insurance doesn't cover. So in other practices, like in the practice I work now, my doctor's a fee-for-service practice. She charges a little bit more. She charges $90 and she gets it. I mean, she's fee for service. She's in a high-end cosmetic area. So it really depends. My preference is, again, if you could stay that sweet spot is like $35. You know, again, if you need to be more affordable, be more affordable. If you know, depending on your area, you can bump it up a little more. I like to stay no more than $50. That's me.
Excellent.
We just get more case acceptance that way. You know, when I've worked with so many practices, like I said, my dentist my fee for service dentist right now, she's an outlier, right? So, but most offices are on PPO plans. People are looking to be tight with their money. They don't want to do what insurance doesn't cover. And so we really try to make their copay when they come in to see us very affordable.
Wonderful. We have another question, this time from Anonymous. We always reschedule our patients that present with a herpetic lesion at their appointment. Could we treat the lesion with the laser and then proceed with treatment, or would we still need to reschedule them?
That is another great question. You know, and I think that's going to really depend on where they are in that stage. If they're in the prodromal stage, I've treated patients before in the prodromal stage because there was no vesicles. Okay. And it was, you know, I felt safe. One thing I didn't say tonight that you guys will also learn through your certification process is you always, even prior to COVID, we've always used a high evacuation system with lasers, especially when you're going over the herpetic lesion. There's potential for virus there, so you're using an HVE, always using an HVE. But you're gonna have to, have your clinical judgment on that. Most of them, if there's any vesicles, we will reappoint. We'll treat it and reappoint. But there have been times where there's no vesicles or anything like that, and we were able to proceed.
Excellent, thank you. Next question. How can you all help with the training needed in Texas for us that consider purchasing the Epic during COVID? And Joe, if you're available to speak as well, this might be something you can jump in on.
Well, is Joe on?
Looks like he's having mic problems.
Okay.
Apologies.
I'll try to answer for Joe, but what we'll do is I'll go back and get you his email. And then also, a lot of you are with the Texas Dental Hygiene Association, so reach out to your leader that helped organize this, and she can put you in contact with Joe as well. But there is a training that is offered and supported through the use of your purchase with BioLace. So when you get this beautiful piece of equipment here, they will follow up and make sure that you're trained and ready to go. And I know Texas is a little different. You do require a little bit more hours, the 12 hours. So you can do a portion of that online. Like I was saying earlier, only 3 hours needs to be hands-on. And so we definitely have, I know that they have, BioLace has solutions to work through that for you.
Thank you, Valerie. So does the diode laser have the ability to remove calculus, or is it just for decontamination, reducing inflammation, sulcular debridement with epithelial and granulation tissue, which seems like a lot of things? No, so it doesn't remove calculus. There are other types of lasers that actually can do that, and that's beyond our typical scope of practice, with exception of maybe Washington and another state. But no, diode lasers are soft tissue lasers. Okay. And from Kelly Arakali, are anesthetics used during laser use? I'm sure that depends on the procedures, but.
Yeah, that's another great question, because remember I talked about pain therapy and fears that patients have. The nice thing about laser is it doesn't hurt. Okay, so it's not going to be the laser that, because we're using a laser, that we need to anesthetize our patients. If we were going to anesthetize our patients anyway, because of the scaling and root planing, the periodontal therapy that we're doing, because we are going to be getting down into those furca areas or getting into those deeper pockets, or maybe our patients, even when we were just probing, you know, those patients that kind of jump or grip the chair. And so you may make that clinical judgment to anesthetize that patient so you can efficiently remove calculus and do what you need to do, but you wouldn't do it just for lasers. There's no need to do it just for lasers. I hope that answers your question.
We have one question from the chat from Arpita Gadam. Does laser therapy replace ultrasonic scaling?
Another great question. No, absolutely not. It's, you know, we still need to go remove, like the other question, it does not remove calculus. So we still need to remove the calculus, use the ultrasonics to provide that lavage, or hand scaling, get the calculus off, but the ultrasonics will do more, providing that lavage, and even help us with, you know, start killing some bacterial cell walls by creating those bubbles in there. But then we use that laser that goes into the light energy that goes into the tissue and then does all these fabulous things that we cannot do with manual instrumentation or ultrasonics. But we still need to do that, the traditional methods of removal, and then the laser is an adjunctive to that. It's getting everything else that we can't, because that's all we can get is the plaque and you know, the calculus. So the laser is going to do so much more at getting to the biofilm, stimulating the healing, you know, peripheralating those cells, building collagen, all the great things that it does.
Thank you. We do have one more. Can the laser treatment cause a perio abscess?
I've never seen anything that says a laser treatment could cause a periodontal abscess. I have seen where patients have had periodontal abscesses in our office, and my doctor performed an incision and drain with a diode. So instead of using a scalpel to get that abscess, we're able to effectively use the laser, clean it out again, and you know, it was less invasive for the patient. But to answer your question, I've never seen anything where a laser causes an abscess. No.
Thank you. Elizabeth Cruz asks, what frequency or setting do you use for ulcers? I have a BioLase.
Yeah, so it depends which BioLase you have. But typically what we're going to see is I like to use it. I start at the 0.4, and you know, did she say, was it for herpetic lesions? I'm sorry.
For ulcers.
Yeah, for ulcers. Okay, so yeah, you want to use it at a low level. And again, that's non-contact mode. So you're just going to hold about 2 millimeters over, and you'll just go over back and forth, you know, back and forth, kind of create hashtags or whatever to cover the whole entire surface. And what I find is that when I talk to my patients, and I say, okay, you're going to start feeling a warm sensation. Let me know when you start feeling that warm sensation. And then I know, usually, you know, we're not even maybe a minute into it, they start feeling it. I know it's working. Now, if it starts to feel heat, your setting is too high. You want to bump that down. Okay. And as you know, it's settings. There's not a one size fits all. We give recommended settings. It's up to the patient's, you know, pigmentation, if their lips are pink, or if they're more purple, or whatever the case may be that attracts that light energy. So we have a basic where you should be, but every patient, you may just need to adjust it up, down, or up, either down or up a little more. So watching the tissue, watching for any type of thermal reaction when you're using lasers for, let's say, laser assisted periodontal therapy is really, really important, because you want to make sure that you're not getting that thermal effect where it's starting to coagulate and self-initiate. But yes, so, you know, definitely just talk to your patients, ask for their feedback, and definitely keep a critical eye on what you're doing.
Thank you, Valerie.
Yeah, that's a long-winded answer. Sorry.
Well, you know so much, it's hard to get it into.
My time. I've been up since 4:30, which is 3:30 your all's time. So yeah, you're all in Texas. I can say y'all, right? So it's a late night for me.
We do have two related questions about post-op care, and I'm sure it depends on the procedure you're doing, but are there recommended post-op instructions, or how do they differ from traditional scaling?
Oh, great. Great, I love it. So with post-op instructions, you know, really what we want to tell our patients is, you know, no toothpicking, no crunchy French breads, Doritos, tortilla chips, things of that nature. You know, and just really avoid that. You also want to avoid some sticky foods, or acidic foods. Sticky, yes, but also acidic foods. So we can, something that's not going to interact with that tissue. But avoid those crunchy foods for about up to 2 weeks, you know, and then also when the patient comes back, most of the protocols show that we do not probe again, you know, for at least 90 days to 6 months, depending on what your doctor's protocol is and your periodontist that you work with. So I've had different protocols depending on the periodontist I was working with as well. But yeah, we will even see where we don't probe for up to 6 months. However, when my patient does come in, we lightly provocate. We don't go in there and probe, we lightly provocate because we want to look at that tissue response, because we pull out the laser again and we're using it to hit, you know, those areas to continue to help our patients improve. So yeah, it's same, you know, same kind of recommendations, soft brushing, no toothpicking, you know, just anything to allow the tissue to heal.
All right, great. We do have a couple more, but we are running short on time, last 5 minutes. How about this question from Anonymous?
These are great questions.
Yeah, it's pretty good amount of them too. So thank you very much for participating,
Yeah.
everyone. So how about this question? How long does LBR take?
Not long at all. I mean, really 5 minutes. You know, you're just going through and it's just a light sweeping motion that you're doing around each tooth. And so really it shouldn't take you more than 5 minutes. And that's why it's such a great adjunct to have to your hygiene program.
Corrine asks, I had a patient that had a lot of food debris while doing LBR and it fumed. Is this normal?
Yes, it is. And oh, I hate when that happens, right? So one way I combat that is in my protocol that I've been practicing this way again for 17 years. And I was really lucky. I went through a great program at the Las Vegas Institute of Advanced Dental Studies and had some mentors there, and I polish first. So that when you get a patient back and you polish them first, you can remove that debris. Okay, so think about it. We're removing that debris if they're a bad toothbrusher, they have anything going on. And then also when we're probing, you're not getting all that debris on your probe too. You can actually read it. You can actually see it. So try that, you know, see if it's something you guys want to do. Otherwise, pre-procedural rinses should help. You might, you know, when you see that, you might need to polish, you know, if you see somebody with a lot of plaque, oral hygiene, you know, definitely pre-procedural a rinse, and then try to polish them or even have them do a light toothbrushing in the restroom. And then that way you can proceed. But yes, what that does is it carbonizes your tip, creates that heat. So you don't want to continue when you see that. And that's why I said it's so important to always watch your tissue response, watch what your laser's doing. And yes, you need to remove it, change your tip or cleave it, bump it down, remove the debris or anything that's going on, and then you can proceed.